Hold on. Okay, we're being live streamed. Okay, beautiful. Welcome, everyone. My name is Sherry Adeosun, the president of the Loom Foundation. And thank you for coming to this wonderful presentation. And we have a special guest. I know you guys are tired of hearing myself and Dr. Cronin on Sunday every day. You're like, when are we going to see a new face? Yes, we have an expert in our midst. Dr. Lamb is a diagnostic radiologist specialist in MedStar Medical Group Radiology MMGR for MedStar Health based at MedStar Washington Hospital Center in Washington, D.C. She is a board certified radiologist focused in women's imaging, breast imaging, and intervention, as well as body imaging. She's a graduate of the New York City School of Medicine. Any New Yorker in the house? Give it up, New Yorkers. Okay, in the medical set, hold on. Our residency training in diagnostic radiology was performed at the Long Island Jewish Medical Center. Our breast imaging and intervention fellowship was completed at the Beth Israel Hospital, Albert Einstein School of Medicine. She then joined the Medical Faculty Association of the George Washington University Medical Center as an attending in mammography and women's imaging. She later joined the Association of Alexandra Radiologists, AAR, as well as chair of the AAR Committee on Quality Assurance. She then took a position at Centara Medical Group in Woodbridge, VA, prior to coming to MedStar Washington Hospital Center. In addition, she is the current director of NVCC Diagnostic Medical Sonography Program on behalf of myself, the entire Relum Board of Directors. Join me to welcome none other than Dr. Lamb. Dr. Lamb, welcome. Welcome to this beautiful platform. I know you have a lot prepared. You can unmute yourself. I'm trying to find you so I can spotlight you.
Thank you.
Welcome, welcome.
Hello, everyone. Thank you. I'm going to share my screen. If you can give me 1 second to share my screen. I would like to thank Dr. Cheryl and her compadres for inviting me to be, part of this as a physician, as a woman in medicine, as a person of color in the country and this world. I feel like it's important for us all to do our part in stopping this disease and trying to help not just ourselves, our families, but our community. It should be connected. Just give it 1 second, please. I apologize.
We can see it.
Time.
We're seeing it.
Is it connecting now?
Yes, we can see it.
Okay. How is the audio though?
The audio is okay. We can hear you well. Dr. Tammy?
Dr. Tam, yes? Can you hear me?
Yes, we can hear you. You seem frozen for a second, so go ahead.
Okay, hopefully now it seems a little bit better. It's a little, I don't know. Unfortunately, I'm not in my home office. I'm actually at a beach, and that's probably why the signal is a little bit different. Hopefully it'll stay stable. If not, Cheryl, we may have to do your backup like you said, okay? And we'll walk through the PowerPoint off of your computer. Okay, so good evening, everyone. My name is Dr. Tammy Lamb. I am a diagnostic radiologist. And when Cheryl, who I've been friends with all my life with, basically, had discussed the fact that she was doing this outreach program, and we would constantly have conversations about COVID-19, working in the hospital and seeing what we're seeing and how it's affecting Black and Brown people in this country. We felt it was really important. I just loved what she was doing, and I was more than happy to be part of it. So when she asked me if I could give a talk, I said, why not? Because people, I guess it's because of my island heritage. I tend to be opinionated. People ask me my opinion about the actual vaccine. And I was very honest with people. Initially, I was like many people. I was like, well, I'm going to wait after the first or second, maybe third round and get my vaccine. I'm going to play it very safe. But as a diagnostic radiologist, I'm not the doctor that's in the ICU. I'm not the doctor or the nurse that's in the ER. I wasn't seeing the people. I was actually seeing the imaging. And just like they say in art, one picture is worth 1,000 words. And this is what helped me to evolve in my thinking. So what I would like to do is basically take you somewhat through one of my days of images I was seeing on cases of patients. So as we know, COVID-19 basically is a respiratory process. It affects the lungs. Early on, we started seeing patients come in, some complaining of coughs and fever, some having one or the other of both. But their chest x-ray, many of them were negative. This to the left is a negative chest x-ray, normal looking, nice grayed out lungs. Others will come in with little patchy areas of white, more fluffy areas of white, or extensive infiltrates bilaterally to the point where they had to be intubated and admitted in the hospital. So we saw early on that people had varying presentations. They would have really low oxygen rates, but have a normal x-ray. They will have not bad oxygen rates, walking around and living their day, but only have a few infiltrates. We also noticed that this could also show the progression of one patient in the hospital. That person go from a negative x-ray to extensive bilateral infiltrates in a matter of days. So the disease was hard to track initially because you had patients that didn't even know they were sick. You had patients that were very sick but weren't passing the disease as much. And more importantly, once they finally came to the hospital, to their doctor, they would advance quickly. And we were just learning how to treat them. So what I'd like to do is take you through a couple of the cases we would see. And this is what helped me to make my decision. Early on, we all knew that this would seem to be a disease more of the more mature person, the more elderly person. This was a 62-year-old woman who actually came into the hospital for kidney stones, had blood in the urine, no cough, no fever, nothing, was not mounting an infectious disease. When you do a workup for kidney stones, you actually take images at the base of the lung. So this is right above the diaphragm, and this is part of the heart. And we started seeing these, again, gray, fluffy infiltrates in the periphery of the lung. A chest x-ray was done, and you would see that the patient had all this sort of fluffy, we call it ground glass opacity, but when I try to describe it to people, it's like clouds, very faint clouds in the periphery of the lung. And at the left lung base had a more dense consolidation. This was the person how she presented. She said she felt fatigued, she felt tired, but really she came in because of kidneys. She had stones, she had blood in her urine, she knew what that felt like. Upon examination in the ER, they noticed that her oxygen levels were really low, so they were going to admit her. She was admitted to the hospital, and over several days, this is the progress, the progression we see. She goes from a person that had a few infiltrates to developing more infiltrates. Now she's being treated now, okay, to more infiltrates, to extensive infiltrates bilaterally, and to what radiologists call complete whiteout of the lungs within 12 days. And this is after she's been intubated for a few days already. So she's being treated. She didn't initially come in for this disease. She came up with something else. That means she was at home, or she could have been in a group home. She's around her children, her grandchildren. When she was just having kidney stone issues, possibly transmitting this to the whole community, right? Because it's not like the flu. The flu, as soon as you show symptoms, that's when you're actually transmitting the disease. With COVID-19, we started realizing people were walking around basically subclinical and passing the disease without realizing. So not only were they at risk, those around them were at risk, their families, their partners, and their communities. This is another example. A 57-year-old person that was working came in actually for respiratory distress. This is as we start to know a little bit more about COVID-19. Realized they should come in. Obviously, their disease was going on for a few days. I think it was 4 days prior to coming to the hospital. They realized that they were having something, started mounting fevers. Same gray, same patchy cloud-like appearance in the periphery of the lungs and at the base of the lungs. Within just the second day of admission, he had more denser consolidations at the base of the right lung. CT confirmed the quick progression from a few infiltrates around the periphery to see larger infiltrates when you compare side to side. Radiology is all about comparison, see the progression and change. So I'm not seeing the patient again, I'm seeing the images. So again, I'm seeing another person, 57 years old. I don't think 57 is old. I think it's a point where we are still vibrant. People are still running. They should be able to, go through these processes quickly, but they were deteriorating rather quickly. More importantly, by day 5, this patient showed up with something we were just starting to realize maybe about in, I think, March and April. Patients were more hypercoagulable. This is a part of the CT scan. And this white structure here that looks like an upside down Y is actually the pulmonary arteries. Those are the vessels that actually feed blood to the lungs so we can get the blood cells oxygenated and send it out to the rest of the body. Well, you see little tubular-like defects right in this one with the arrows pointing, and the cylindrical defect, that's called a thrombus. Patients were presenting with hypercoagulable state. This patient, by day 5 of admission, was showing multiple vessels that were actually blocked by blood clots. Again, when you look at radiology, you look side to side. This is what it should like, nice and bright and white. Instead, it was grayed out with soft tissue. See that little dot in the middle? That's a blood clot. You see, this is sort of cut off. These are blood clots. Extensive bilateral blood clots in the person that had no real other risk factors for being hypercoagulable, except for the fact that they had COVID-19. So I'm starting to see more of this. Patients are starting to get younger over the months. This is a 48-year-old who came in for respiratory distress. We're more aware of COVID. Beginning CT scans, we started doing more CT scans. Washington Hospital Center is a level 1 trauma center, but it's the only level 1 trauma center in Washington, D.C. So we're getting patients for COVID-19, trauma, heart. We don't necessarily, some places said that you should only do CTs, X-rays and start from there, but our protocol was quick to incorporate CTs, sort of similar to what the Chinese were doing in their actual plan. So we do CTs quickly, and you can see the progression. This is a 10-day progression. You see some faint infiltration periphery, extensive, and this is probably at every 2 to 3 day interval because we were still learning more about the disease, more extensive infiltrates, very extensive infiltrates. And then by day 10, you have dense consolidation, but it's no longer gray, but it's actually more white. It's completely white out, dense consolidation. So all of this is basically trauma to the lungs, ongoing inflammation, infection, trauma to the lungs. And like the last patient, he developed blood clots. Again, this is the pulmonary artery, and now the person has extensive central pulmonary emboli. 48 years old, progressed that quickly in just 10 days. This probably was when it really started turning for me. This is a 30-year-old male, working well. Yes, he has diabetes. Diabetes was well controlled. Not exactly very heavy set, but you think about all the risk factors they like to put out there. This person was working very well. You can tell by the side of his rib cage, he's not overly overweight. He just started feeling a little bit tired, fatigued, had a cough, and his family insisted that he come to the hospital. His belief was, although I have diabetes, I'm doing other things. I've been able to function for so long. I haven't had an exposure. He worked in construction. Construction continued through DC like crazy throughout COVID. And he came into the hospital. Again, chest X-ray, very faint, few little faint infiltrates in the periphery of his lung. By the second day of admission, you see it sort of graying out completely. You see, you can't even see the bottom of the hemidiaphragm on day 3. This young gentleman progressed so quickly that on day 5, he had another complication of being of hypercoagulable state, of throwing blood clots. He had a stroke. This is a 30-year-old male. Although he has a history of diabetes, well controlled, doing all the other things that were correct, and he developed a stroke in his cerebellum. This is the upper part of his brain scan, which is normal. You can see side to side is sort of equivalent. This is at the base of the skull, which is called the cerebellum. And you see this dark gray area. You can't really see that here. Well, the MRI is better for looking, at the cerebellum, and you can see this bright white area. It's like a light bulb that goes off. This is a 30-year-old man that now has a cerebellar infarct. It was shown, the reason they even did it was because he was still walkie-talkie. He was trying to get up to eat. They had learned that patients shouldn't lay down. We learned that from Italy. But his gait was off, and he had a change of mental state, and that's what they did the CT. This is day 5. He had started, this is less than about 10 days from his initial onset of symptoms. This is how quickly it progressed. For this patient, by day 10, he had other signs of hypercoagulation. He had pulmonary emboli. So when I started saying more of this, I kept on telling people, the problem with the way they were communicating, regardless of your politics or whatever, if they had been honest, the mortality rate would have been high, but they weren't speaking about the morbidity. They weren't talking about the consequences of getting this infection, of the constant trauma to your organs, not just to your lungs, but to multiple organs. And therefore, ending up, if you survive, living with scarred tissue, scarred organs, you're basically now could have a disability, right? Your lung function may be cut by just 10, 20%, but to have that happen at age 30, to lose some function in your brain at age 30, you're talking about a lifetime of disability, okay? So what we do know when I started thinking about all these cases, I was like, okay, we know COVID-19 predominantly affects the respiratory system. And the reason is because of the pathophysiology. The virus connects to a protein structure that is very abundant in the periphery of the lung, but it also does something to our vascular system. It has some kind of associated coagulopathy. The patients form blood clots. And if you form blood clots, whether it's venous or arterial, you have a structure that travels throughout the whole body, which means it can affect any organ in the body. It can cause injury to any organ in the body. It can cause failure of any organ in the body. And that's why you would see people with strokes, with kidney problems, with pulmonary emboli. I think there was one main article that jumped out to me, and I was telling it to my husband probably 2 to 3 months before I saw an article come out in New York of a 40-year-old woman who survived COVID early on. And about 3 or 4 days later, she was having symptoms and went to the hospital late, and she had a major cerebral infarct. A large area of tissue of her brain she had an infarct. A woman that has no history of this. Instead of having infarcts what we expect at age 60 and 70, 80, or having underlying reasons, we're having large vessels that were clotted off, not the small, tiny vessels that you may hear about in your grandparents, let's say. So you had younger and younger people developing stroke. My friend who works as a researcher in neurology and works with a drug company, that's when they started saying that we're going to see dementia developing earlier, maybe 10 to 20 years earlier in the next couple of decades because of the vasculopathy that's affecting small distal vessels of the brain. So we're all seeing this evolve. I'm watching this and I'm still saying, I can still possibly wait to the second go around to get my vaccination. But then I started seeing more solid organ injuries. I saw a 26-year-old woman that came in and I thought she had lupus because both of her kidneys looked like she had lupus. And they said, no, she just has COVID-19. The reality is by the time she healed, her actual renal function had decreased by almost 50%. This is a woman that later on may end up needing dialysis or replacement kidneys. Both of her kidneys were injured. You all read about myocardial infarctions. You heard EMT talking about they would go to be called to people's houses, and people were dying quickly of myocardial infarctions in New York. They were having heart attacks, and people saying, "Oh no, this is not related to COVID-19." But when they compared it to the year prior, the percentage of people having heart attacks was much higher, and the only thing that was different was COVID-19. Well, now we know because of the way that the organism can, one, infect certain parts of the body. It does inflame and infect the cardium or the heart, but it also affects the blood vessels. So you're getting smaller infarcts of blood, that's because the blood flow to these organs are not being, is not allowed, they're being blocked. Musculoskeletal. I saw a 21-year-old woman who came in, her arm had been hurting, her fingers are changing color. She had no blood flow, cerebral fossa down her whole arm, at risk of losing fingers and her limbs simply at this point. How about the actor that was on Broadway in New York? You remember there was an actor that the wife talked about, he lost both of his legs. Unfortunately, later on, he passed away. This is an example. This is a disease that was affecting much more than just the respiratory system. It was affecting, which is the most extensive thing, our venous and arterial system. Abdomen. I saw people come in with bowel infections and everyone thought it was something else. And we were like, no, they're having ischemic events. I saw a person that was pretty young, I think in their 40s, 47, that ended up with a colostomy because they ended up with bowel infarction. This is a disease that we talked about mortality, but we did not talk about morbidity. Fortunately, in medicine, we started talking about it more. Articles started coming out. The next couple of images I'm going to show you are just simply images that are from one of our favorite, what we call the Bible in radiology, called radiographics. It would just show you the incidental findings people will start finding. This is a person who has the aorta, which is the main arterial flow in the body. This is in the thoracic cage or in the chest. There's a thrombus right here, just floating out, okay? This is the heart. Within the right ventricle, there's a large blood clot in the middle of the heart. For some reason, all over the body, you're having these episodes of clot formation. I mean, there are reasons to it, but I don't think that's something we need to go into tonight. The whole point is that this is not just a disease of surviving, having lung infection. This is a disease that can affect your whole body. This one, 17-year-old. Now, the reason I saw it is because my godson is a basketball player. Not an ounce of fat on him. He's in the best health ever. He runs 5 miles a day. Pericarditis. He was having chest pain, a lot of his lungs, and this is from pericardial infection, okay, secondary to COVID. He healed fine. He was fine. He got infected a second time. This is before the vaccine was allowed in his age group. And now they think he may have a tiny little scar. Not a lot, and he'll probably do well. But the point is, this is before, he's even hit 20 years old, okay? This is a case of a 59-year-old that came in for altered mental status. Remember I talked about some people having strokes? 59 years old, no other underlying risk factors. 59 is still pretty young. Large territorial infarct. This is all infarct. And it was secondary to the fact that he had blood clots that were being thrown off, and one of the major vessels in the brain was actually clotted off, and it was throwing off smaller emboli. This is a 29-year-old woman. They had discussed how women might be at risk for venous thrombosis. It's another form of blood clot. As you can see on this side, the vessel's patent. On this side, it's not patent. She had a hemorrhagic bleed. This woman will have a deficit. She also has what we call midline shift, where part of the brain is so swollen that it's pushing it to the other side. Kidneys, again, this person is lucky enough to only have about 1/3 or 1/2 of another kidney affected, but there's still decreased kidney function in 57-year-old that may lead to having renal problems later on. I don't know about you, but I know people are living longer. My grandmother lived to be 104. My father lived, people are living longer. You want to live a vibrant life where you're not worrying about medical issues. So this is a serious disease, and I think it was really important for them, but they did talk on, because I don't think they went to scare people, or we didn't know enough about it, about the morbidity of COVID-19. Finally, I'm just showing you a few more examples. This man, yes, he's an 80-year-old man that had infarctions of the spleen and inflammation of his urinary bladder. This is another patient of 54 that came in for abdominal pain, no other symptoms, no cough, no fever, but came in for abdominal pain, blood clots in his blood supply to his bowel, and he ended up having ischemic issues to his bowel, and he had to have surgery and have tissue resected. So in the end, when I had to ask myself the question, to vaccinate or not to vaccinate, I told myself, one, I know messenger RNA is not new technology. As a physician, and I work a lot with women imaging, I do a lot in oncology, I knew this modality has been used for years in treating in cancer patients. I also knew that it was not new to infectious disease. SARS and MERS is where this actual technique developed from. And SARS and MERS, was over 10 years ago. So this is based on research and utility that's been around for more than 10 years. It's not new. It wasn't, people were like, oh, this was done too quickly. It wasn't done too quickly. This was research that unfortunately, in many ways, because SARS and MERS never became the pandemic they expected, they stopped researching it, but it was on a much smaller scale. So when it was time to actually do research on COVID-19, stuff was done concurrently as opposed to consecutively. You didn't have 4 different stages of actual vaccine research being done at 4 different times. You had things being done all at the same time. And it was piggybacking off of information or research that had been done over the last 10 years for SARS and MERS, and more importantly, for how it is successfully used in the treatment of many oncology patients. So for me, when it came to the question of to vaccinate or not to vaccinate, I signed up for the vaccine. I told Sean, I told my partners at work, I said, I am not going to get vaccinated to the 2nd or 3rd round. By the end of the year, when they said, Dr. Lamb, the vaccine is here, do you want it? I think I was the first one in line. Had no trouble. I got the vaccine right away. I am a person that, similar to like when you get the flu shot, some people get the flu shot, they feel it right away. I'm very sensitive to the flu shot. And I've been getting it every year because I work in the hospital. And yet with this COVID-19 vaccine, I got Pfizer. I had no problems the first shot. I only had a little bit of a sore arm. And I put it in the arm that I use the most, because the whole idea is if you exercise in the arm, the pain won't be as bad. The second time, I felt a little bit like I had the flu. It lasted for exactly 20 no, I'd say 48 hours. I was tired. I went to work. I had no other complications. I've had my mother vaccinated. You know, my family, most of my family is vaccinated. And I did it not just for myself. I did it for my patients. I could not go around my oncology patients with the idea that I could be possibly carrying it and not knowing, because as I showed you at the beginning, you had patients walking around not knowing they have COVID. And in COVID-19, unlike the flu, you are definitely transmitting it. I couldn't be around my own family. People that, my husband has an autoimmune disease. I had to be careful for him. I had to be careful for every child in my family. I had to be careful for my friends' family and my community. And again, I had enough understanding of the science behind it to know that, yes, the history of how people of color have been treated when it comes to medicine, I understood it, but this was different. The research was not done on people of color. In fact, it was done on other people. It was actually done, a lot of it came from Arabic countries, so that's where MERS and stuff was most prevalent. But this, to me, seems like a duty of mine to do as a physician, as a woman, as a wife, as a daughter, to help myself and those around me. So when people ask me, do I vaccinate, to vaccinate or not to vaccinate, my answer is always yes. So that's it.
Excellent. Wow. Let's give the Kalam a round of applause. Thank you. Thank you. Thank you. Thank you. Thank you so much. Stop sharing.
You're welcome. I'm going to stop sharing so
yes,
that the connection is good too, I hope. All right.
Okay, great. Excellent. Thank you so much.
Thank you so much. That was wonderful. That was absolutely wonderful, because that's a question that we get a lot in the field. People say, oh, well, I'll just, if I get infected, it won't be a problem. It's just like the flu. But they don't see this aspect of it and the consequences. And one of the statements that you made is, if you're a young person and you get a complication, this is the rest of your life.
Rest of your life.
Yeah.
Now, and I will be honest with many people. People say, well, you still survive it. It's not that much. We are seeing a little bit more healing after people have bad infections. But the reality is you're still starting off with a deficit. And you don't know which person you're going to be. I have my godson. It had not an ounce of fat on him. An athlete does all the same things that say is right. He got affected because his sport is a one-on-one sport. And look, the second time around, he has a tiny scar. Who knows what that could mean 20 years from now? That poor young woman who loses, half of a limb. I look at that actor. He's an actor. He was all about health. Remember, eating well, doing everything else, and he still lost 2 of his limbs. Having a stroke. I have a woman, a good friend of mine. For personal reasons, I didn't use her stuff. I don't know what it was, but we just decided we wouldn't use her imaging. But this is a woman who, in her 40s, very active in politics. She got infected very early on. Her family lives in Florida, and this was before we knew a lot about it. She got it. She survived it. 3 or 4 days later, she was fine. What, again, they don't talk about is the morbidity of it. You can survive it, but you may end up with scar tissue. And the other thing I didn't discuss, because I think it's another area, is that it may keep some people in a hyperinflammatory state, regardless of whether you survive the initial onslaught, regardless if you don't get thrombotic events. For some reason, there are, they call them long-term COVID, long haulers, right? COVID long haulers, COVID long haulers. And you'll see them discussing it. She has had, unfortunately, small little strokes in her 40s. No cardiovascular disease before this. She does not smoke, never smoked. She doesn't drink. She's a very health conscious person and always has been. Fortunately for her, she has both the money and the opportunities to get the best help possible, and she's under control. But picture for the majority of the people that don't have that access. When I'm talking about getting vaccinated, it's not just for your own health. It's not just for your family. It is a community. Unfortunately, there is disparity between the have and have-nots, and unfortunately, it seems to be worse with the Black and brown people. But I just say between poor and not poor, right? And that includes everyone. And to me, community is everything. I don't care what your religion is. I don't care what your race is. I don't care what your politics is. Hopefully we can all have civil conversations, but if my community is hurting, we're all hurting. And we learned that through COVID. We're all being isolated. You're not around your community. You're not having the opportunity to go to church with people that you may not even agree with everything, but that's still part of your community. You can't go to school. You're not around your community. You know, mine was, I love to travel, and I have not been able to meet the world because of this. You know, we're doing this for more than just ourselves. And I think it's important. I think it was just too politicized why people aren't getting vaccinated.
Yeah, and I think it's really important to highlight the consequences, the long-term consequences. When you were showing the radiograph of the person with pericarditis, and I was thinking about, you know, all the patients that I've treated with pericarditis for other reasons in the past. But pericarditis is around the heart. There's a tissue called the pericardium, and it's a sac that the heart resides in, and that sac got infected with COVID. Okay, and even though you may recover, it's scar tissue. And think of it this way. I'm going to be a little graphic. Okay, so when you have a chicken or something, and you cut up that chicken, and you'll notice that there's a tough, fibrous layer sometimes around, like they'll give you the parts, they'll give you the giblets or whatever, and there's this tough, fibrous layer around that. Or even if you have like let's say like spare ribs, on the back of the ribs there's this membrane that attaches all the ribs together. Okay, that's like the pericardium. And imagine that getting infected. You may recover, but then that tissue becomes hard and just so tough. All right, so you have that around your heart, and it's hard and it's tough, and your heart is trying to beat within this tough sac that doesn't expand. Okay, because, you know, when your heart is beating, it's expanding and contracting, and the pericardium has to go along with the beat of the heart. But if that pericardium is scarred and tough, and just imagine, you know, like when you're doing your ribs and you're trying to pull that part off, and you can't do that. All right, and your heart is struggling, and this is years. Okay, and you may end up, well, the long-term treatment for pericarditis is we usually start with non-steroidal anti-inflammatories like naproxen or Motrin, something like that. But eventually, when it gets too bad, we have to go to steroids. And so you may end up being on steroids for a long period of time, for the rest of your life. And if you're a young person and you've suffered this consequence, imagine having to live X number of years on different medications to manage the symptoms of pericarditis. So
I think, thank you so much, Dr. Crony and Dr. Lamb. I think one of the things that stood out for me, which ironically this afternoon when my husband came in, he was talking about how stroke is, how COVID affects the kidney. And I was like, what? I never knew that. And then for you to come and really show the imaging of the effect of COVID on the kidney, the liver, you know, and other organs that you might not even think they're respiratory related, it's really like mind opening. But my question is, I know we're all like on different journey when it comes to coming to a place of deciding to get vaccinated. And I'm so glad, Dr. Lam, that you shared your journey with us, how you got to that journey and the things and that helped you to make that decision. And I know there's somebody in the audience, I don't know if they want to share where they are in their journey, because this is really a judgment-free zone, a place where we want to just try to bounce off ideas and try to share facts, I know there's so many myths out there, half truth, untruth, just being mixed up and being thrown at us, even as people of faith, trying to like sort of attach these things to our faith to make it more like more real, So I don't know if anybody want to share their journey. I mean, for me, my own journey was, actually really coming from Better Gospel Tabernacle, and we have an intercessory chat and seeing my brothers, my sister, hearing when people were dying during the depth and the highlight of the COVID. I'm like, who is dying today? And every time I see an alert come on, I'm like, oh my God, who died again? And that was like so like very stressful. And I remember us praying for a miracle. We prayed for a miracle of a vaccine to happen. Yes. Day and night, that was the prayer, 6 a.m. prayer. Lord, we need a miracle. Give the scientists wisdom. So when it turned around and it happened for me, I was like, okay, God has answered our prayer. We don't want to be like Peter. They were praying for Peter. Peter was at the door, knocking at the gate. The girl went to tell them, Peter is there. They said, no, we're still praying. It cannot be at the gate. If the Bible scholar will understand those stories. So I think, go ahead, Dr. Lam.
I was going to say, that was exactly the prayer of my mother. My mother, who was going to be, she's Catholic, she was going to be a nun before she got married and ended up having 7 kids. And she says, God created each and every one of us as well as our jobs. He's the one that created the doctors and gave them the knowledge and the ability to do it. And when she saw the woman who did the vaccine, my mother said, I had a prayer where I saw a Black woman would be the one that would save the world with the vaccine. So when she saw the person, she was like, this is God's answer. This is what we needed. This young Black woman to create the vaccine so that people of color would know why it was safe. God purposely put it in her hands. And my mother, Cheryl, you know my mother, right?
Yeah.
She to me, I tell her she's a walking angel. When I take my mother on vacation, she's a kind of like the Pied Piper. You know how babies, they say children are so innocent. You take her, all the babies got around her. She is literally like a walking angel. And when she told me that, I said, Mom, I'm going to share that story because that is exactly what I believe. I believe that there was a reason why the person who created the vaccine was exactly who they were. A young Black woman.
I did not even know that. You're going to tell us that story. And I'm sure a lot of people on this platform did not know. No. You're going to tell that story. Go ahead.
So the woman that that did it, she had already been doing research on SARS and MERS for years because she had already, all she was waiting for was the actual virus to be identified so they can sequence the genome. But she works, I believe, with Pfizer.
Yes.
I have to look up her exact name again. And they've had her on TV. And I'm talking about a young woman. I think she's in the 30s or late 30s, early 40s. And she said, we were just waiting. By the time they gave her the sequence, she had the answer within 48 hours. Worked all night, all weekend. Messenger RNA, like I told you, is a process that has been around for years, for decades. And I think it was actually developed because of SARS and MERS, but they were able to use it in reverse for oncology patients. It really gives you a much more sort of, I call it a concierge sort of treatment. It is specifically to treat the actual genetic, makeup of whatever you're dealing with. And that's why it's been so helpful in oncology. So that's what happened with this. And so she said, people like this happened overnight. She goes, it didn't happen overnight. This is 10 years of research. I was just waiting. I just need the final, it's like doing your Christmas tree, right? You're putting your Christmas tree together. She was just waiting for that final star to put on top. And that was it. But it was a young Black woman. As my mother, when she told me that, I think my mother is very prophetic. I always have. And I think she is, again, I think the innocence in this world is with children. And I always say the way children come next, gather around her, she is truly an angel. So when she told me she had this dream, it was before my mother doesn't watch all the different news. She doesn't watch any kind of the medical news. So she didn't know this woman. And when I told her, I was like, Mom, this is the person that did it. She's like, what? So I really believe. And I also, as a person of faith, I believe that God created each and every one of us. He didn't want this to happen. Just like you said, you had a prayer saying we want a vaccine, and that's what happened. A vaccine developed. So I tell that to many people that are, saying from a religious point of view that they don't want to get vaccinated. But I was like, God created each and every one of us, every doctor, every scientist. They're the ones that he's the one that created us. And that's why we're able to do this. So it's an incredible truth, I think, that we need to spread a little bit more so that people realize, but also just the knowledge that this is not new technology. I think people believe that it was new technology, and unfortunately, because of the division of the last administration, whether I don't care whether you're Republican, Democrat, Independent, whatever it is, I think it was just politicized as opposed to just speaking about the facts. And this is not about politics. I think this is about people's health.
Absolutely. Yeah. I totally agree with you. It is not about politics. It's about people's health. Something as simple as wearing your mask, I mean, is really, really important. Apart from the vaccination, there's so many other layers of protection that we're strongly encouraged to put in: wearing of our masks, washing your hands, and sanitizing and social distancing. I know everybody want to hug up on everybody. I'm like the hug police at the church. I'm like, no. I said with a fire laughing. I'm like, no, don't get here. Only elbow. That's how we
elbow. I don't even do elbow. I do Wakanda forever. That's my new thing. I used to do this. I am a hugger. Having patients, especially again, I deal with cancer patients. I used to hug my patients like crazy. My new thing though is I don't want to get them sick. I know they're fighting the thing. Mine is Wakanda forever. I don't want anybody to appropriate it. I don't do my I do Wakanda forever. That's my hello to everyone. And if you're looking at Japanese culture, they give a certain automatic distance out of respect. You don't have to hug and kiss up on everybody. We can all show our love, tap your feet, do the elbow, do the Wakanda.
Yes,
that's my favorite, yes.
Absolutely. So I don't know if Sunday want to add something. Like Sunday, do you want to add something to this? Because this is like your territory. You've been seeing patient, all this going on during the pandemic. Do you want to add anything to the conversation?
Well, like the doctor said, I was like number 7 on the line to get the vaccine because I actually saw it firsthand. And it was a very terrible situation to see a lot of young people be walking talkie, and immediately you intubate them, they just go like that. So it's not a very nice thing. And right now on my unit, I would tell you, let me just not exaggerate. I think 60% of all the kidney transplant we're doing right now was caused by COVID. My unit. So the residual effect of this virus is so great that you don't even want it to touch your body. And it's just something that, I mean, even right now, I was talking with some of my colleagues. I said, I mean, I don't want any of these things to come around again because I don't even think I have it in me to go through it again. So if we prayed and we have the vaccine that is available, actually taking that vaccine is an act of faith too. For you to go to a restaurant to eat the food they're going to serve you in most restaurants is an act of faith because you don't know what they put together. So my encouragement to everybody here today is that if you're still on the fence, it's time to take a stand. But taking it or not taking it is still an act of faith anyway. So, but it's very, very important that this thing, the residual effect of the virus is so great. And we're still seeing it every day in the hospital. And majority of the people coming to the hospital right now, people wouldn't even get the vaccine right now. And those who got the virus, they're coming for the transplant and a lot of other things that is going on. Some of them are on dialysis. Some of them, once they get sick, any other sickness they get, they can't even tolerate dialysis. Some of them had to be placed on CVVHD, a different kind of machines that, that we have to use because they can't tolerate the whole dialysis stuff. So that's just what I have to say. The doctor said it all. She showed us everything, and those things are true.
Thank you
so much, Dr. Lam.
Thank you so much. You are the best. Thank you, everyone. Really appreciate it.
Thank you for what you're doing.
I want to say something. Like as Sunday was talking, it just came to me. I was thinking of, one of the discussion we had. Somebody was talking about natural immunity. But one thing you have to realize is even before you develop that natural immunity, you're already exposed to it. You're already compromising your organ. So next week we're gonna dig deep into the difference between natural immunity and the immunity that you get from vaccine, and we're gonna really like compare both. So you guys, those that in their 30s and 40s and they're stronger, mighty, and they feel like they're untouchable by COVID vaccine, we're gonna be able to talk about it. I mean, we are people of faith. We believe that prayer works, but at the same time, God has given us wisdom, given us doctors, professional people that have dedicated their life to science, and discovering all these things. So that is why it's important for us to really be mindful. So there's some questions on the chat, and I'm gonna like ask you, since you're the special guest, so you're on the hot seat today.
I can answer whatever I can.
The first question, thank you so wonderful audience for putting your question in the chat. And if you want to say your question, you can use the emoji, raise up your hand, and we will unmute you. So Ms. Sargent is asking why and how after getting the vaccine, you can still get COVID and die. This is a problem with the younger people. They do not believe in the vaccine.
So first of all, again, I think it comes to understanding what a vaccine is supposed to do. The whole idea, I use the flu vaccine. It's one of the best examples. We get the flu vaccine. It's a virus, okay? So it's the same basis. We get the flu vaccine every year. They usually try to target what they hope to be is the prevalent flu vaccine virus that year. Doesn't mean you don't get it, but if you do get it, hopefully it's a short-term illness. You're not getting a full-blown infection. So the whole idea about vaccination is to prepare your body so that it quickly recognizes and the healthy immune system can quickly knock it down before it actually overwhelms. Because this is actually a process, the way it begins or the way it progresses so quickly in the body is that it actually makes your own immune system over-attack it. And that's why the lungs quickly become flooded. So you want it to recognize it so early on when it's like, the Trojan horse is coming. There's only about 10 people in there. You don't want it to attack it after it's been all over your body. So the whole idea of a vaccine is to make your body aware of this organism being out there, to quickly knock it out. Doesn't mean you won't feel sick, but instead of being sick for 10 days and quickly progressing, you may feel bad for 1 or 2 days. It's just making sure that your body can actually recognize this virus as it enters. And by doing that, by hopefully knocking it out before it multiplies and changes, you're decreasing the chance of it morphing into something else. Now, Cheryl can tell you more. She's the infectious disease doctor, but that's how I always try to explain to my patients. It doesn't keep you from getting it, but it does hopefully make it less virulent. And when you think about someone who passed away, like poor Colin Powell, he's actually a friend of my father-in-law who's a Marine. The reason he passed away is that he was already immunocompromised. He had cancer. He got vaccinated, but his body was already fighting another disease. And then he got COVID-19. So even though his body was aware of what to attack, it still couldn't handle all of the different processes he was dealing with. But Cheryl can be a little bit more specific because she's the infectious disease doctor.
Well, I was going to say that.
Dr. Cheryl, let me just add to that question before you answer that, but the time is fast spent. There's a question regarding fertility. I know we addressed it in one of our presentations before about young women who are concerned about vaccine affecting their fertility, and then the difference between the mRNA and DNA. Try to see if you can address it. If not, I will just send the recording to the person that has the question. Go ahead.
Okay. Well, in terms of, the vaccine is not 100% effective. All right. If we remember, the Pfizer and the Moderna are about in the 90s range, 90 to 95% effective. And the J&J, I think, is in the 70s range. So it doesn't mean that the vaccine is the end all be all, but you want to take it because the likelihood of you being in that 95% group is very high. Okay. And so there is the small percentage of people like anything else, who will not and do not respond to vaccines. But you don't know that until you take it, you know, and this is just the way of life. You know, it's effective to a point, and you don't know if you're that person that it's going to not be effective on, because of, like Dr. Lamb said, because of underlying illnesses that you may have. You know, like Colin Powell had multiple myeloma, so it's a cancer of the blood. And so other illnesses that people may have that affect them, you know, those illnesses have broken down their bodies already, and then they take the vaccine, and so it may not be as effective as in someone who doesn't carry the same morbidity or range of illness that they do. So that's a potential reason for why some people take the vaccine and they still end up ill or getting COVID, or, you know, succumbing from COVID because of their comorbidities, so their illnesses, underlying illnesses that they have. In terms of the fertility question, we do not have any evidence thus far of COVID causing infertility. As a matter of fact, the opposite, as during the trials for the vaccine, people became pregnant, and there have not been any reported adverse outcomes of their pregnancies. So that's a myth that's going around out there, that COVID causes infertility, but there's no evidence to support that myth. Okay. There's a question in the chat about someone having had COVID and why should they get the vaccine. Is because the virus, yes, it stimulated a natural immunity, but that may not be sufficient quantity of immunity to help you fight infection should you become secondarily exposed to COVID. So your own natural immunity might not be sufficient for you to fight another infection with COVID. What was the third thing, Sherry? Or was I see John or June, they have a hand raised.
Oh, the mRNA and the DNA. Okay, I'm gonna have them unmute and speak.
Okay.
And then the other thing is also, you know, I know it was said already, you know, according to the statistic from the Department of Health and CDC, you know, very high percentage of people that are hospitalized, and even when they do get COVID, that has severe sickness, like over 98% are those that were not vaccinated. So the data speak for itself. The percentage of people that actually get COVID after being vaccinated and end up dying is very, very minute, less than 1%. I mean, so that speaks for itself compared to at the beginning of the pandemic when everybody getting in and a lot of people were dying because we didn't have vaccination at that time. So it's changing.
Right, and of those who were vaccinated and did get a very severe form or died, had several comorbidities.
Oh, that's a good point.
That's one thing that's the thing. That's a very good point. These are people that had other issues. They were like Colin Powell, older age, has a cancer already. Some people, a weight issue is a combination. They looked at their comorbidities and they had several comorbidities why they actually passed away.
Brother John, go ahead. Or Sister
Yes,
John.
I apologize if this question has been answered already. We joined a little bit late, but my wife and I have both been vaccinated. I just got a notice that I was eligible for a booster. So the question is, you know, how do I know whether I need a booster or not? Should I get antibodies? Should I get tested for antibodies, or you know, I don't want to take a booster yet if I don't need it?
Well, right now, I cannot tell you the answer to that question, but the recommendation or the guidelines are stating that if you're eligible for a booster, that you should get the booster. There is some evidence to show that the vaccine wanes over a period of time. So your immunity wanes over a period of time. And therefore, in consideration of a booster shot, we will have to wait much longer to find out the answer to that question in terms of people who don't get the booster. So it's like any other vaccine. So right now we know, for example, that the flu vaccine, you have to get it every year because the flu virus varies. And so, they try to get a vaccine that's targeted towards this year's variant of the flu. With the COVID, we already know that there have been several variants. The Delta variant in particular is very infectious, and there are other variants that are out there, Lambda and such. But we haven't been in this long enough to know, will the vaccine hold, will the 2 doses hold for the long term? And I think really out of an abundance of caution, is more why they're recommending the booster. Yes, there is debate going on, but we won't know the answer to that until time passes. So, it's going to be a decision between yourself and your provider, your physician, as to whether or not you should take the booster. But the general recommendation is, if you fit into a category to take the booster, to take the booster.
Okay, so to talk more about the booster, we have a flyer that we had created. We actually had one Monday that we dedicated to the booster and the 3rd dose. So I can also forward that particular link to you, Deacon John. So just text me later. I'll send you the flyer that sort of summarizes everything that Dr. Cooney says, so you can look at it and review it. And there are 2 questions in the chat. I don't think we have time to take that. So Sister Rosie, you're here every week. We answer the question about Delta virus variant, next week. And the other question about mixing the vaccine. You want to quickly take that? One of you, what are your thoughts on mixing vaccine? I know it's been recommended that they can mix for.
Well, I think in some of our previous discussions, there's just 2 things. In our previous discussions, we talked about the difference between the Moderna and the Pfizer, and how the Moderna actually has more immunogenicity to it than even the Pfizer, because of the formulation of the Moderna. So you can go back to one of our previous webinars and look at that. And then the second thing is describing the mRNA. In one of our previous webinars, we also had a slide to show just what the mRNA is versus how other, like, for example, the flu vaccine was formulated. So that we also have in one of our other presentations.
So if you want some of those links sent to you, you can just drop your email on the chat. But if I contacted you through WhatsApp group chat, so that means I have your information, I'll just drop it on everybody. I can bombard some people, but yeah, I'd rather be targeted. You can just put your email so I can send it to the people that really want it. It's really been a great night. We don't like to keep people more than 8:05, it's 8:01, but I want to share this video with you. At Team, we're always creating like creative video to sort of address the need in the community. So this video I'm about to show you is actually created by Simisola, our creative director. Whoop, whoop, whoop. The Simi is on traveling tips during COVID-19. Enjoy. And if you want it, I can send the link to you.
And here are some traveling tips during COVID. You may be wondering if it is safe to travel domestically or internationally if you're not fully vaccinated. No, if you're not fully vaccinated, you should not travel. This is because you may encounter the virus during your travels, or you may have the virus unknowingly and infect others that are more susceptible to the virus. Tips before you travel. Make sure you understand and follow the airline and destination requirements for the state or international destination, as you may be denied entry if you do not meet the requirements. Many destinations require that you take a COVID-19 test 1 to 3 days before you travel, or provide COVID recovery documentation within the past 3 months. Tips during travel. Make sure to wear a mask over your nose and mouth on any form of public transportation, regardless of your vaccination status. This includes public buses, trains, and planes. Also, make sure to sanitize and wash your hands regularly. Do's and don'ts when traveling during COVID. People who are not fully vaccinated should avoid heavily populated areas with poor ventilated spaces. This is because the virus spreads more easily between people in close quarters. You can, however, participate in outdoor activities such as hiking, rollerblading, biking, fishing and hunting, golfing, rock climbing, kayaking, canoeing, and diving. Tips after travel. Get tested with a viral test 3 to 5 days after travel. Self-quarantine for a full 7 days after travel. If you test positive, make sure to isolate to protect others from getting infected. If you don't get tested, stay home for 10 days and avoid those that may be at risk for severe illness. But most importantly, make sure to monitor for COVID-19 symptoms. Whether you're traveling or not, it's important to protect yourself and others. So visit vaccinefinder.nyc.gov to find a site for you, or call 877-VAX4-NYC to find a site near you. For any further inquiries for the Relum Foundation, call 646-715-2009 or email us at relumf@gmail.com. Thank you. We at the Relum Foundation are so happy that you were able to learn some more traveling tips during COVID. Make sure to sanitize, wear your mask, and stay 6 feet apart. See you next time.
Yeah, don't you love that?
Excellent. Very nice.
Okay, so we actually have several videos. We have a video actually for the Delta variant alone. So if you want something specific, I can send that to you. And yeah, excellent. So thank you very much. Closing thoughts, Chairman, Dr. Coney.
Thank you so much, Dr. Lam, Tammy, my childhood friends and neighbor.
And to our audience,
my neighbor.
And to our audience,
I appreciate you so much. Thank you.
I appreciate you for doing this. No, this is the sort of stuff where, again, if I could be a help with anyone and be involved in this, I think is incredible. So thank you for inviting me. I know all my life. Cheryl even taught me how to play piano. You remember you were piano teacher?
Okay, wow, that's awesome.
So I love it. So please continue. If I can ever help again, if anyone has any questions,
absolutely.
I have a different approach, but please.
We're returning offenders, so we will be back. Okay. We're gonna be back.
Okay, thank you, everyone. Have a great night.
It's been a great night. Just as a form of announcement, we have tutoring section coming up for students. So if you have any student from kindergarten to 12th grade, we're planning to start November 1st. Please, you can email me. Most of you know my number or my email. Get in touch so we can share with you the link to have your daughters, your sons, your young people get one-on-one tutoring. Figure that out, one-on-one. We did it all last year. We're starting again. It was very productive. Thank you for all the teachers on this platform that supported. And we have about 25 teachers signed up already, waiting for students. Go figure that out. That's interesting. And also on Saturday, we're actually doing a virtual launching of our New York office. Woo-hoo! Are you excited? We are so excited, right? We're opening a New York office. If you can come, it's going to be at 5 o'clock. We've been sharing the information. It's not going to be long. We know we don't keep you guys so long. 1 hour maximum. That's it. And we're out. Thank you. Have a good night. God bless you. I appreciate all of you.
Good night, everyone. Stay safe.
Thank you. Thank you.
Thank you, Dr. Lam. We appreciate you.
Thank you.
Thank you.